Last year, more than 1,000 people had joint replacement surgery at Good Samaritan Hospital. But as you're about to see, that kind of surgery at this particular hospital is more than just your average joint surgery. It's a joint experience.
Joint Experience at Good Samaritan Hospital is a coordinated comprehensive total joint program. We schedule our patients for total hip and total knee surgery and then work with them from prehab to rehab. We've got nurses, case managers, social workers, physical therapists, clinical pharmacists, physician's assistants, nurse managers, and myself, the program coordinator. We meet every morning at nurse rounds to talk about our patients, to see how they're doing, how they're progressing, how's their pain management doing, how did they progress in therapy, what are we anticipating for their discharge.
What makes the program work so well is education and communication. All patients who come in for hip or knee surgery come to a class in advance of their surgery to have a concept of what goes on. It is far different now in terms of hip replacement and knee replacement than it used to be.
We have this fabulous prehab, which is preparing your muscles and your bones and joints for the surgery to make you stronger, to get you ready to get up and out of bed as early as the next morning after surgery.
We do lots of specialized procedures here, from minimally invasive hip and knee surgeries to hip resurfacing procedures, all of which are somewhat unique, and the patients having a better understanding preoperatively of the specifics of their program, their prosthesis, and their rehabilitation, as well as feeling comfortable with the staff, has really accelerated the rate at which they improve and left them with a much more positive feeling about their experience in the hospital, which sometimes can be quite intimidating.
Just take your time.
They go through physical therapy a couple times a day, and to make them feel a little better on their second day, we give them a nice back neck massage. We have massage therapists that come in on post-op day 2 and give them massages, and everybody looks forward to that. They have a newspaper guy that comes through and gives them a Sun paper every morning so that they can stay in touch with what's going on in the rest of the world.
We've got these group lunches in the gym up here where you can kind of commiserate and pat each other on your back, where everybody's just had, their joint replacement surgery.
We have found that when folks work in a group, they seem to compete in a positive way with each other. We have a little board with different little racehorses for each room to see how the folks are walking, and there's no question when somebody who may be in their late 50s or early 60s feels like they're struggling, and they see a person in their early or mid-80s making apparently a greater effort at their rehabilitative process, it seems to inspire them to do a little bit better.
Joint Experience has a volunteer program that we're really excited about. It's made up of former patients who have been through hip and knee replacement, shoulder replacement, and they are just to help escort them to therapy. They sit side by side with the patients and help them go through their exercises, and what a better teacher than someone who's already been through it.
I respected and admired all the people that helped me, and people gave to me, and I'm privileged to be able to give something back. I tell everybody that Good Samaritan is the hospital with a heart.
Any problems with nausea? My primary job with the Joint Experience program is monitoring and dosing of the anticoagulation program. That primarily means use of Coumadin or warfarin to help prevent the risk of blood clots after hip and knee surgery. It's important to have a dedicated pharmacist because that way one person really knows the patients. I've worked in infusion pharmacy, I've worked as a consultant in long-term care, I've worked in corporate, I've worked in purchasing, and this is the most rewarding position I've had. It gives me a chance to be a better pharmacist with that one-to-one, face-to-face interaction. We have refined each aspect of the program so that if somebody, a person, a loved one comes here for a joint replacement, they can feel comfortable that they are getting a specially designed program with specialized professionals in all aspects of their care, from the physician to the therapist to the nurses to the people involved in coordinating their social service needs, that they're getting a very specifically constructed program that is just for them.
People think they have to suffer with this, and they don't. There's great help, and it's here at Good Samaritan.
If everything goes as planned during and after surgery, a patient who goes through the Joint Experience at Good Samaritan can expect to be home in about 3 days.